Hi, Dr. Mark Agresti. I want to do an educational piece on lithium. Lithium is a naturally occurring element that is found in the soil and the land around us. Lithium is probably the best treatment for mania, mood cycling, and depression out there. There's probably nothing better. That's the good. It works very well, very successfully, and it's been used since a man named John Cade discovered its benefits in 1949 in Australia. Now, when we look at the good, it looks pretty good. You're like, wow, this should be used more. Now let's talk about the bad. Lithium puts on weight. It retains fluid. It increases appetite. It makes people gain weight. And the weight is apparent. It's not a little amount of weight, 10, 15 pounds. Lithium not only puts on weight, it increases your thirst. And if you increase your thirst, you have to urinate more. So it makes you constantly thirsty, and it makes you have a dry mouth. And when you have a dry mouth, when they speak, they make a noise like this that gives them away and makes them appear to look like they have something wrong. And already people with mental illness may be stigmatized. This will stigmatize them more. There's another side effect which could be even more problematic: acne of the face and back. They start breaking out these red pimples all over their face. It's not pretty. And it's cosmetically disfiguring, but doesn't hurt the patient, but it stigmatizes them because cosmetically they don't look good. And I don't like doing that. Another cosmetic side effect doesn't seem to hurt people, but they develop a tremor of their hands. And what patients have reported to me over the years are saying, people think I'm a drinker. And that's another problem with lithium. It makes people tremor and look like they're drinking. Not only does it make you look overweight, dry mouth, and always puckering with your lips, frequently having to drink, urinate, have acne all over your face. But another thing it does is it makes you mentally slow. Your delayed response to questions, you can't remember, you're slower at work, you're not as quick with comments, you don't catch things as quick, you're not as funny, you're not as you're not as animated. Another issue beyond cognitive slowing is you can develop diarrhea, loose stools, vomiting. But also, I think another disfiguring thing is muscle coordination and muscle weakness. You just don't seem to be as coordinated or move as well. These are pretty big problems. I mean, no one is a big problem because all drugs have something, but this is pretty systemic, all-encompassing, cosmetic disfiguring of a patient. Blurred vision is very common. So they have trouble seeing, they're overweight, they have acne, they're uncoordinated, they can't think clearly, they're slow, they're mentally dulled, they have tremors, they get nausea, vomiting, loose stools, they frequent urination. That's the bad. You're like, after I say the bad, what could possibly be worse? Well, I don't want to alarm anyone, but these effects take years, maybe 10 years for them to take effect. Severe side effects, where your kidneys shut down. A third of the people who are on lithium may develop some chronic kidney disease, diabetes insipidus, glomerular, or interstitial nephritis, meaning your kidneys don't work as well. You need your kidneys to live and for water balance and to balance electrolytes. And when you develop this lithium-generated kidney problem, you may have trouble balancing fluids in your system. And you may start urinating all the time, and your body just spills fluid. I had one patient who needed a kidney transplant from lithium. I virtually do not use it. I have not written a prescription for lithium in years. The only time I get involved with it when someone comes in my office and I immediately say, you got to get off lithium. Don't panic if you're on it. It's not need to panic because it takes like 10 years or more for any problems to develop. And if your doctor's following you, there are very competent psychiatrists using lithium, and I would say it's okay. I don't agree with it. It also causes hypothyroidism, meaning your thyroid shuts down. It's a gland right here that is involved in metabolic control of your system. And if your thyroid shuts down, you get depressed, gain weight, cold intolerance, constipated, muscle problems, muscle weakness. Hyperthyroid can cause irritability, anxiety, agitation, rage. So the medicine you're using to treat mood can actually affect thyroid, which causes mood problems. There are treatments for some of the side effects of lithium. The tremors, you can use Inderal, which is called propranolol, to block the tremors. For the frequent urination and thirst, you can use amiloride. You can dose the lithium once a day. Usually doses are between 6 and 1,200 milligrams a day. And this will minimize the long-term side effects of lithium. Lithium is given in range of 0.6 to 1.2 MEQs per liter, milliequivalents per liter a day. So it has a therapeutic window. If the dose gets too high by dehydration, by using Motrin, which is ibuprofen, or naproxen sodium, these drugs cause the dose of lithium to skyrocket. Once the dose is too high, or you took too much in an overdose, it can cause brain damage, it can cause toxicity, and kidney damage. So overdose of lithium is dangerous. So you're giving someone who has depression and possibly suicidal thoughts a drug which is easy to overdose on. And lithium does not work well with alcohol. Alcohol dehydrates. When you dehydrate on lithium, the level goes up. Alcohol can cause vomiting and diarrhea in overdose, and that can make the lithium skyrocket and make diarrhea, vomiting, and dehydration even worse. So it's cascading series of events that are exacerbated when you mix alcohol with lithium that could make it toxic and cause serious brain damage, kidney damage, or death. Lithium, when given, you really need to check I would say, twice a year, the lithium levels, the kidney levels, and the thyroid to make sure everything's okay. Maybe once a year, twice a year. It depends who you're seeing. But all these problems with lithium are the reason that I do not use lithium in my practice, and why I choose to use other drugs first. And not because I think it doesn't work, or not because I'm saying the psychiatrist who's given to you is wrong. I just don't agree with it. I would rather use something that doesn't work as well, that's safer and not as disfiguring and has less side effects and doesn't have as much risk for overdose and doesn't have as many drug interactions. The drugs I use would be Lamictal, lamotrigine, Depakote, which is valproic acid, Triliptal, which is oxcarbazepine, Latuda, which is lurasidone, or Abilify, which is aripiprazole. These are the drugs which I think should be used prior to trying lithium. I'm not saying lithium doesn't have its place, but it's not my go-to drug or go-to element, whatever you want to call it. So I'd be real careful if you're on lithium. Don't panic, but I would recommend coming off it and trying something that's not as dangerous, disfiguring, and has as many side effects, drug interactions, and doesn't have the risk of causing a thyroid problem or a kidney problem. Thank you, Dr. Mark Agresti.